Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapists. For this video, I want to share a couple of pros and cons and different characteristics of the different methods of closing the wound, the incision with knee replacement surgery. Talk about some of the good aspects of the different types and some of the bad aspects, just so you have a little bit more education and information about when it comes to your own knee replacement surgery. So first we'll talk about staples. So a couple things to consider when it comes to having staples is one, you're going to sometimes end up with these little marks on the side of your scar, and it almost looks like kind of these little railroad track marks. For some people, they're a little more prominent. Some people, they tend to fade and aren't really that noticeable. But there is that little bit of cosmetic appearance of those little marks along your scar. Another thing with the staples is they tend to be a little bit slower. It takes a little bit longer for the wound to close and to approximate. So typically this is in the range of 7 to 10 days for this to happen. You also have to consider with the staples, you have to either have another doctor's appointment or a medical professional has to come to your home to remove the staples. So it's another appointment to do that, have that the removal of the staples. Another thing to consider is when you're doing exercises after your surgery, such as range of motion exercises, especially like the bending and flexion activities, people tend to notice that there is kind of this uncomfortable pulling sensation that they notice when they're doing bending exercises, and this can be a little uncomfortable. Sometimes people say like they feel like the staples are just going to pop right out. This won't really happen, but it's that sensation and it feels a little strange and uncomfortable. The good thing about staples is a lot of times it allows for a faster approximation and closure of the wound. So if you think about during surgery and at the end of surgery you want to close off the wound, close off the incision, this can be accomplished very quickly with the staples. And especially a lot quicker, you're able to achieve wound closure a lot quicker with the staples rather than, for example, using sutures or stitches. Another common way of closing the wound off and closing that incision is the use of the glue. So a couple things to think about with this is one, it tends to be a little bit more cosmetically pleasing. You don't get those little markations or railroad tracks that you would get with the staples or even with the stitches. For the glue, you actually do have to have some stitches and sutures for the deeper tissues that are cut. So the deeper tissues will usually have some sort of absorbable stitches or sutures, and then the glue is used on the more superficial layers and on the skin, and again to provide a little bit of that cosmetic appeal. Another benefit of the glue is you can shower within 2 to 3 days, so you're able to shower a little bit quicker, which is very nice and helps you kind of regain that normalcy a little bit faster. The glue is going to dissolve over time, so there's no appointment needed to remove, such as with the staples or the stitches, or sometimes the stitches are absorbable, but staples you have to have an appointment to get them removed. With this, you don't have to with the glue. There tends to be a decreased risk of infection, or at least this is what's advertised, and the reason they believe this is so is because with the stitches or the staples, you're increasing the punctures into the skin, so you're increasing these locations where there could be openings and places for infection to enter the system. With the glue, you don't have to add those new puncture areas, and you're also closing off that incision in a very efficient manner. The glue tends to be relatively fast and easy to perform during the surgery, so you don't have to worry about time constraints as much. And again, there's that cosmetic appeal, less of a scar usually for most people. A couple of things that on the con side or the negative side is it tends to be a little bit more pricey, a little higher cost for the glue. Some people have allergies to the glue and can't use it. And if you're at risk for slow healing of your wound and your incision, for example, if you're someone with diabetes or cardiovascular compromise or impairments, then you actually can't use the glue because we need to approximate those the incision quicker, keep those areas tight, and allow for that closure. So if you have any risk of slower healing, then usually the glue is not an option. Another option is the sutures or stitches. So a couple benefits of these are usually they're going to be dissolvable. So again, unlike with the staples, you don't have to have another appointment or procedure to get those removed. They tend to approximate better and bring the skin closer than you would with the staples. So the staples, sometimes you kind of get that bunching up together of the skin. This is less likely, and it approximates and comes together a little bit smoother with the stitches sometimes. There is that increased risk of infection as you're, again, making those punctures again, same with the staples. And the stitches tend to take a little bit longer because you, of course, have to do, sew the needle, sew the suture through all the areas. Another option that is relatively new is the use of what are called zips or zip stitches. And basically what these are, they look like little zip ties, little plastic zip ties, and they go across the incision, and then on each side along kind of longitudinally or parallel to the incision, you have adhesive. And a couple of things with these is, one, they're easier to monitor because they're clear and it leaves kind of this open space along the incision. They also are relatively easy and painless to remove, which is a positive. They tend to have a little bit less scarring or limited scarring, or at least they're marketed in this manner that they tend to not have as much of scarring and it'll be a little more cosmetically appealing. They're also adjustable, so you can adjust the tension of the zippers, the zip ties, so you can have them tighter or a little bit looser depending on how the wound is healing and how the doctor is observing it. And they're marketed as being 8 times stronger than staples or sutures. And again, the closure is relatively fast, and you're able to achieve that closure in a fast amount of time that is comparable to the other options available. So that's the main options out there. For determining which one is going to be best for you, a lot of it is going to come down to having that discussion with your surgeon. Surgeon might have a preference for a certain way of doing it. There also might be certain things that might prohibit you from using certain kind, like we said, such as an allergy or a risk of having a slow wound healing or slow healing of the incision if, for example, you're someone with diabetes. So it really comes down to discussing your options with your surgeon and formulating kind of the best plan and the best option for you. But of course, I hope this helps you to be kind of informed and know what the different options are and some of the pros and cons, and you can have that constructive conversation with your healthcare provider. Thank you very much for watching, everyone, and have a great rest of your day.